Hey everybody, Luke here, and today's video is all about back surgery, which is not my favorite topic. Probably not yours either if you're considering back surgery, if you've had it. And the reason being, obviously, is that back surgery is just can be very difficult, can be very life-altering. Obviously, it's needed at times, but it's a game changer for a lot of people. So, biggest topic for today's video is back surgery. Is it right for you? And what are some things you can do to kind of minimize the chances of back surgery or to speed up the recovery process, things like that. So back surgery, is it right for you? The first thing I want to touch on with that topic is that with any type of surgery, it's always the last option. So people that are having back surgery, with any luck, you've gone through and you've tried everything you can. You've tried physical therapy, chiropractic, aquatic therapy, injections, whatever you can to avoid back surgery. And the biggest tip I think there is just you want to treat your back pain quickly. So, you don't want to just wait for 10 years and then say, oh, I'm just getting closer and closer to back surgery. Just like anything else, if you can treat it quickly, your chances of avoiding things like structural damage to your spine and to your lower back and avoiding surgery are much, much better. So don't think, even with mild pain, if you've had it for, longer than a couple months, which certainly a lot of our clients in the clinic have had it for years and years, do everything you can to get on top of those things early, again, because you're going to decrease the chances of having structural damage to like the joints and the discs and things like that. And overall, over the lifetime of your spine, you're just going to reduce the likelihood of needing surgery in the first place. Along those same lines, when you're looking to avoid surgery long term and just be good to your back overall, a really good just general rule and tip for back pain is just to really avoid prolonged sitting. And when you are sitting, just watch your posture. And again, it may seem like a simple tip or just kind of a throwaway tip, but it's really hard on your back to sit for prolonged periods. It's probably the number one thing that really bothers people's backs, with the exception of like physical labor that's lots of bending and twisting and things like that. So don't overlook that too. If you can correct your sitting posture and just not sit so much in general, usually that's going to have a very positive effect on your back long term, and again help you avoid surgery. Last thing I wanted to mention when it comes to back surgery is that a lot of people who end up having a back surgery, like a more invasive one, like a fusion, they end up doing that because they have nerve pain. So nerve pain, like shooting numbness, tingling pain in the leg, could be along the front of the thigh if it's higher up on the back, or the lumbar spine, the lower back. And for some, it's more like a sciatica type pain where it's shooting down the back of the leg. And my best advice for nerve pain is if you have nerve pain, act on it very quickly if you can. So I usually just say, like, don't mess with nerve pain, especially if it's a nerve pain that you can't get rid of with certain positions. So with like a milder nerve pain, it could be usually relieved, like if you sit down and stretch forward or something like that. Usually there's a position you can find that will relieve it. If you've got long-standing, constant nerve pain, your nerve is being damaged, and a little bit of damage over a long period of time, it takes you 6 months or a year or 2 years to get into surgery. By that time, even if you take the pressure off of that nerve, you may have actual permanent nerve damage, and that nerve may hurt the rest of your life. So again, if you've got nerve pain, act quickly. Talk to your PT, talk to your chiropractor, talk to your doctor. What can you do to relieve the nerve pain naturally? If you can't relieve it naturally with conservative treatment, will an injection do the trick? Will something along those lines do the trick? And if not, do you need surgery? So if you do need surgery, again, I talked about this in my last video I just made about hip surgery. If you need surgery, it's a good idea just to figure that out quickly. So again, if you've got back pain and it's severe, if you've got nerve pain, act quickly. Again, if you need to see your primary care physician to get things going, or you've got a PT or a chiropractor you can work with, just gather information quickly and decide if conservative treatment is going to help you. And if it's not, and you do need back surgery, then just get it done quickly so that you don't have any long-standing issues with things like nerve pain. So those are my tips for you today for back pain. Obviously, I hope that you never have to deal with it, but if you do, again, just act quickly. If you have any other questions about back surgery or back pain in general, just leave me a comment below the video or send me an email. Thanks for watching.